Good morning, everybody. I want to thank you all for joining us today. And I want to begin by thanking Bishop Claude Porter for hosting us today at Proviso Missionary Baptist Church here in Maywood. I want to thank Israel Rocha, Chief Executive Officer of Cook County Health, Dr. Kieran Joshi, and of course Dr. Porter for being with us, and all of whom will be speaking today. I'd like to thank Lainey Kleeman and Michael Albert, who are our sign language interpreters. And Commissioner Brandon Johnson, thank you. Commissioner Brandon Johnson, what's the matter with me? Right here in front of me. All right, we're going to hear from Bishop Porter in just a few minutes about why he participated in this effort. For more than half a century, Bishop Porter has fought for the people of Proviso Township, and he's quite a force and a voice in this great community. Along with Bishop Porter, we have several other Cook County residents who volunteered their time and voice to encourage community members to get vaccinated. We'll tell you more about them shortly. Also joining me is Israel Rocha, CEO, Cook County Health, Dr. Kieran Joshi, who is co-lead of our Cook County Department of Public Health, and of course Commissioner Brandon Johnson. Today we're launching a public awareness campaign called My Shot to encourage the people of Cook County to get the COVID-19 vaccine. Every day I talk with residents across Cook County about the pandemic and now about the vaccine. While many people are overjoyed to get vaccinated, I also hear reluctance, fear, and misinformation. I understand why some people are unsure. I understand that some people are hesitant. The My Shot campaign speaks directly to these individuals who need to hear from their neighbors about the safety of these shots and the importance of making the choice to get vaccinated. In a collaborative effort involving Cook County government, Cook County Health, the Cook County Department of Public Health, this campaign will remind Cook County residents of the many reasons to get this vaccine. This effort is driven by data and rooted in the principles of equity. Messaging will be hyper-targeted to reach the most vulnerable communities that have been disproportionately impacted by the pandemic. We reached out to our neighbors to learn their reasons for getting vaccinated, and many of them volunteered to share their stories through the My Shot campaign. I'd like to personally thank those who could join us today for being part of this effort, and I'd also like to take a moment to highlight some of the things they told us. Bishop Dr. Claude Porter, our host today. PLCCA founder and longtime community activist in Proviso, got the shot after seeing three of his nephews contract COVID-19. He says if you want to save the people in your families and your communities, get the vaccine. Lonnie Hodges, owner of Lonnie's Young Cuts Barbershop in Jackson Park, tells his customers, I believe in the science. The sooner we all come together, the sooner we'll all get to enjoy everybody's company once again. Emily Inman is a childhood cancer survivor who works at Respond Now in Chicago Heights. Her work helping people get food, housing, and medical support was in dire need this year. Emily lost her aunt to COVID-19 and is medically vulnerable herself. She believes the shot is her chance to become a mom. Idadal Shalabi, co-founder and executive director of Arab American Family Services in Bridgeview, has seen firsthand the impact of the pandemic on her community. She took the shot to be an example to her friends and neighbors and family. George Vaughn of West Pullman, an operator of Ranch House Meats, has supplied local restaurants and families with meat and seafood for decades. The pandemic has been hard on his business, forcing him to close his warehouse and serve his customers from his truck. George says the vaccine gives him hope that he will soon be able to get back to what he loves, serving his customers and spending time with his new granddaughter. Sharing these and other stories is crucial to getting our communities to come together and get vaccinated. I want to introduce you to the campaign photographer of this project, Sean Balutya. I hope I did that right. Close? Close. Say it right for me. Baluyat. Okay, Sean Baluyat. Originally from New Jersey, thank you for coming to Illinois. The child of Filipino immigrants, Sean stayed in Chicago after attending Loyola. He originally set out to be a doctor, earned a degree in health systems management, but the creative side of him was taking him to a different path. He has worked for Adidas, Nike, Lululemon, and Chance the Rapper. And you will see his authentic portraits and video storytelling are emotional and uniquely captivating. Thank you, Sean. We'll see Sean's work throughout the multilingual advertising campaign using bus shelters, billboards, radio, digital, video, print, and social media. We hope to reach those communities that have seen more than their share of suffering throughout the pandemic. Residents will be directed to the website, myshotcookcounty.com, which features vaccine information and resources, frequently asked questions, and a toolkit with graphics and posts for community groups to share. We know that reaching the most vulnerable communities in Cook County is critical to putting this pandemic behind us, and we are confident the My Shot campaign will help us do just that. Let me tell you why I got my shot. Because it's safe, it protects me and my family from COVID-19, and it puts our community one step closer to a sense of normalcy. I urge all my fellow residents in Cook County to do the same. Now, I'd like to introduce Commissioner Brandon Johnson to say a few words, with my apologies for overlooking him the first time. Thank you, Brandon.
Madam President, it's okay. I know my skin looks much clearer and cleaner now. Might have been hard to recognize me. It's okay. It's on there. There you go. But good morning, everyone. Bishop Porter, thank you for your commitment and your long-standing history for our community and our people. It means a lot to us. You know, tomorrow will mark a year from the first recorded death that's documented related to COVID. And when Patricia, a 61-year-old retired nurse, a black woman, died because of this virus, it became especially hard for her family because 9 days later her sister Wanda died to the same disease. And the loss that we've experienced over the course of this last year has been tremendous. You know, it's important that we document and remember those lives that and those families who will never be the same as a result of this pandemic. But it's also important that we provide some direction and clarity of how we can get our communities back to a more safe state. Thank you, Sean, for your commitment and your work. I'm sure your family is incredibly proud. And if the Ramblers make it to round 2 against Illini, it's going to be difficult to see who we're going to root for. But being able to capture our stories the way you have is essential to making sure that our community knows that this is the right thing to do. I was talking to Bishop Sappho before we started, and our neighbors and our communities, as President Preckwinkle has indicated, have had a tremendous amount of hesitance as it relates to not just the vaccine, but how government engages with our community in general. And it's okay to critique. It's okay to ask questions. Most importantly, it's okay to make sure we get it right, because lives are at stake. And so now we've gotten it right. We have leadership that is seeing the world through a lens that is calling for equity and justice. So we're encouraging members of this community and communities throughout Cook County to help make sure that our families can be secure and safe again by getting vaccinated. The information is right, and we have community members here that can substantiate that. The last thing that I'll say is leadership matters. It does. Because without proper and good leadership, people lose. And isn't it about time that our communities begin to win again? And so for the leadership at the health and hospitals and the public health department, Brother Rocha and Brother Kieran Joshi, thank you as well for being willing to stand up and provide all of the necessary information and everything that's available to us, to our community. So on behalf of the 1st District and throughout Cook County, we encourage families to get the information and to get the vaccine. Thank you. And now we will hear from Mr. Rocha.
Good morning, everybody. Good morning. Good morning. I want to first start by thanking President Preckwinkle, our commissioners of the board of the county, as well as all the public health care leaders and the county participants who have joined us here today for their leadership. I can say that in helping to lead our healthcare efforts during this time, it is always an amazing support to make sure that no matter what time you call or what you need or when you need it, they're there. And I want to thank the President and our commissioners for always being there for us. My name is Israel Rocha. I'm the Chief Executive Officer of Cook County Health. When our organizations began developing this campaign months ago, we recognized that the root of our efforts in equity and was needing to be authentic. We needed to reach out directly to Cook County residents. We needed to meet them where they were making their decision process, at homes, at work, in the tables around united by their family, to connect with people and make sure that we had the information and resources that we needed to give them the information that they needed, to gain a first-hand understanding of the concerns about the coronavirus vaccine. For this reason, our agencies partnered with MarketProbe to conduct a survey of 1,100 Cook County residents of various zip codes and backgrounds. Today, I would like to share the results of this survey, which informed the development of the My Shot campaign that you will be learning more about in the days and weeks ahead, and we're here to start the process. Through our research, we found that among all Cook County adults, 32% were hesitant about the vaccine, with the most hesitant age group being between the ages of 18 and 34 years old. Health, protection, and family were the top reasons why people wanted to be vaccinated, while concerns about side effects were most often cited as a reason for individuals' hesitancy. Perhaps most importantly, the survey found that 46% of African American Cook County residents, 35% of Latinx residents had stated they probably would not, definitely would not, or were unsure if they would get the vaccine. While disheartening, this discrepancy, often called vaccine trust gap, is not surprising. We know that a history of mistreatment and racism in healthcare and the disproportionate impact of the pandemic has contributed to mistrust in our communities of color. And we must address those concerns, we must speak about them openly and honestly, and we must make sure that we provide information to regain that trust, especially in the communities that have been most impacted by the pandemic. To everyone listening who's had a question, who's had a thought, who believes that maybe the information you're hearing is not there, we want to let you know that we hear you. Your questions, your concerns, and your hopes for what life would look like after this pandemic is over and we have been vaccinated are there and are in the foundation of our principle behind this campaign. We hope that the My Shot campaign will provide you and your family with the resources and educational material you need to make your decision to be vaccinated. The resources are just one part of the effort to ensure that equitable distribution of the vaccine throughout Cook County occurs. Earlier this year, we opened the county's first large-scale vaccination site at the Tinley Park Convention Center, followed by sites at Triton College, South Suburban College, and in Des Plaines. Additionally, targeted locations and pop-up sites that seek to reach priority populations like seniors, teachers, first responders, and communities most impacted by the pandemic will also be open in the days and weeks ahead. Our partners at the Cook County Department of Public Health have also worked to distribute the vaccine to more than 145 partner locations throughout the county. Like President Preckwinkle said, we all get our shot for different reasons. As a healthcare provider, I made the decision to get as a hospital worker, I made the decision to get my shot because I wanted to make sure that, first and foremost, after a day's work, I didn't go home and endanger those that I loved. I wanted to make sure that I had protection for my immediate family. And I would one day like to see my family again, my parents in Texas, my sister in Texas, and others, and would like to be able to travel again and be able to make sure that two things. First and foremost, that I'm not spreading the illness to others, and secondly, that I wouldn't be able to get it, and we could be united and just enjoy each other's company, our laughter, our friends, our family, and not have to worry about the endangerment that can come from pandemic or passage of COVID. I urge all Cook County residents to get vaccinated. The science is there. You need to make your decisions. Trust begins by having an open dialogue, open information, and resources available to everyone so that they can make that decision for their family. The My Shot campaign is a powerful message because it uses a message of individuals who have decided to take that shot, why they made that decision, and to share their story. If there's one thing we've learned through our research when it comes to vaccine hesitancy, it is that when individuals hear the stories of others, those stories empower them to make the decision for themselves and for their family. We can overcome hesitancy through information, education, and we can overcome inaccurate information about the vaccine with the truth. The My Shot campaign is a true story of individuals who have made the choice for themselves, why they made it, and we will make sure that you have the information to make the choice for your families. We make a commitment to make that available to everyone, to make sure that equity, information, and the empowerment of your decision starts today with this site, with our information and our commitment that we have set all along. We are here, and we will be with you through the entire duration of this process, and to make sure that anybody who wants to get vaccinated has the opportunity to be vaccinated. We ask for patience as we enroll it, but we are very excited to hear from our leaders that we will hopefully have much more vaccine coming in the future, and that's why we're so excited to start this campaign today. With that, I would like to introduce Dr. Kieran Joshi, co-lead of the Cook County Department of Public Health, who will share more information about the safety and efficacy of our vaccines. Thank you all so much.
Good morning, everyone.
Good morning.
Thank you, Mr. Rocha, for the introduction. Thank you, of course, Madam President, Commissioner Johnson, and of course, thank you, Bishop Porter, for inviting us into your home. I am Kieran Joshi. I'm the co-lead and senior medical officer for the Cook County Department of Public Health. I'd like to speak today on some background on the vaccines and how safety was prioritized since the early development of the vaccine. And I want to speak to you not only as a physician, as a public health doctor, but as the son of two seniors and grandparents, as the husband of a frontline healthcare worker, and as the father of two school-age children. So the vaccines that are available today were created with everyone's safety at the forefront. And I really want to reiterate that there were no skipped steps during development. For the past year, research institutions, pharmaceutical companies, governmental agencies, and philanthropic organizations came together to dedicate their resources and time to developing these amazing public health tools. This increased financial support allowed researchers to conduct different parts of the development process at the same time, instead of one after the other. This is what has led to the approval of 3 highly effective vaccines that we're so thrilled to be able to offer in Cook County. The vaccines were developed based on existing technology and years of previous research in other mRNA-based vaccines and viruses such as Ebola, MERS, and Zika. All of this work enabled for a rapid development process. The now approved COVID-19 vaccines were evaluated in tens of thousands of participants in clinical trials. The vaccines met the FDA's rigorous scientific standards for safety, effectiveness, and quality, all needed to support emergency use authorizations. The clinical trials were inclusive of participants from communities that have historically been underrepresented in clinical research and have been disproportionately impacted by COVID-19, including communities of color, participants over the age of 65, and those with high-risk chronic conditions, all of which put them at risk for increased risk of severe COVID-19. Again, these vaccines were created with safety in mind. Getting your shot is the best way to protect yourself and those around you, and will help to keep our entire community healthy and safe. When you visit myshotcookcounty.com, again, that's myshotcookcounty.com, to learn more about the wonderful people featured in our campaign, you'll find many, many resources to answer your vaccine questions. This campaign will hit not only the airwaves, it'll be seen on bus shelters, in community centers, on billboards, and on Instagram. We've also engaged dozens of community-based organizations to help us educate and engage individuals who may be hesitant. These organizations in the south suburbs and in the west suburbs, and right here in Maywood, where Bishop Porter, his church, and the organization he leads, the Proviso Leiden Council for Community Action, better understand the community and what information is needed to help us beat this pandemic. In the coming weeks and months ahead, we look forward to watching our vaccine rates rise and our COVID cases decline and our church pews fill up again. Thank you so much. I'm now going to turn it over to Bishop Porter.
Good morning.
Good morning.
Madam President, we're glad to see you, Bishop Johnson, and to all of the medical staff that's here. When I was asked to get involved in my shot campaign, I did not hesitate. I stepped up right away and said that I was willing to do this. And why am I willing to do it? This morning, if you check your figures, that's 572 people that's dead. 572 people that's dead. There's 1,400 people that's dying every day. That's dying every day. And if you check the numbers, you'll find out that the largest percentage of those individuals that's passing away are the black and brown communities. Yet when the vaccine came out, it was being given out to all these other folks, and then doubt was put in our minds that we should not take it because there's something wrong with it. They're trying to trick us. They're trying to abuse us like they did 50, 100 years ago, and et cetera. All kind of misinformation was passed out. And I said to myself that if I do my shot myself, I could be the example to all those other folks and let them know it's all right, that things is well with this shot, that you need to take the shot if you're going to be able to continue to be with your family, to hug your wife, your husband, and your children, your grandkids, and etc. You're going to be able to embrace them. You need to take the shot. You can't stand back and be in doubt, and etc. You can't be misquoted, and etc. You can't decide about which shot should I take. Any shot that becomes available is a shot that you need to take. It's a shot that's going to save your life, going to encourage you and help you to continue to live in this society. The president said the other night, said by July, the 4th of July, we might be able to go back in the backyard and have our barbecues and our family together. Well, let me tell you this. If you don't take the shot, I want to preach, mother. If you don't take the shot, you're not going to be able to go in no backyard and have no barbecues, etc. You're going to be laid up in a hospital somewhere, and so we need to take the shot. I said I want to take the shot so I can continue God's mission, continue God's word. I want to take the shot because we need to get the churches filled back up again so people can praise and celebrate and give God the glory. We need to take the shot. There's nothing wrong with squirming a little bit when the needle hits you. I did the same thing. But I stand there today and tell you, I feel good right now. And I don't want to feel good just by myself. I want you to feel good because you took the shot. You made a difference in your community and in your lives. So everybody stand up and say, my shot.
So you don't want to have to speak after Bishop Porter.
As we get the Q&A going for questions, just a heads up, there's someone driving a Buick who
who's blocked someone in. So you're driving a few. Please don't.
All right, do we have questions, Nick?
Yes, we have WTTW on the line.
All right, WTTW.
Hi, thank you for taking my question. I was just wondering when the survey was conducted that was used to inform the campaign.
The question is, when was the survey conducted that informs the campaign? Pardon me? All right, the survey was conducted in January and the beginning of February. It's about 30 days ago, finished up.
Thank you. I have just one other question about the campaign.
Sure.
Tell me a little bit about how individuals were chosen to participate.
Who was chosen to participate? The people in the survey or the people in the campaign?
Oh, sorry, the people in the campaign. Thank you.
All right, how are the people chosen to be in the campaign? All right, so who participated in the campaign? Some people bubbled up out of the survey, and others were leaders of community organizations that we've worked with either on the public health side or on the county side. More questions? Alex?
Good morning.
Good morning.
So I have three questions all on the topic of vaccinations. First, what do we know at this point about the racial equity record of the county's vaccination campaign so far?
All right, just a second. One question.
Economic information about who has been getting doses so far.
Wait just a second. Wait, Alex. We're going to ask one question at a time. All right, so the first question is on racial equity. Israel, do you want to speak to that? Racial equity in the vaccination process so far.
So I would say, like all parts about the country, and it's one of the things that we don't want to run from, there has been a lag in our communities of color. Now, we have been making up for that ground over the last few weeks, and we've been monitoring it, and as we get the numbers closer together, we'll even be sharing those numbers publicly. And so we have seen that we are trailing behind in our communities of color, and that is really why campaigns like today are so important. And that was why it moved us to act, to survey, to fill those gaps, to understand what was the areas that we looked at. And so we have seen a trail across the whole country. We're seeing that. And so today is just part of that process on how we help to address it. And we hope that very soon, as more information comes out there, and we have been seeing some very positive trends in the last few weeks. And so we hope those will continue and the gap will be remedied. Thank you.
All right, what's your second question, Alex?
Just to quickly follow up on that, you're saying that no information has been put out so far, but it will be soon if trends improve?
So he says no information has been put out so far, but it will be put out soon as to the racial composition or the proportions within each.
So there are, correct, there are information that has been shared by the state, and we do put out information about our numbers. When it comes down, a lot of the information is just making sure that we vet it, and those are for the overall county and suburban. So we will be having some reports that will come out shortly, because we want to make sure that the numbers are accurate, and we're getting very close to that time. We put out information about how many shots we've given, with the population, the zip codes, and then we're working on making sure that the racial composition about that is also shared very shortly.
All right, what's your third question, Alex?
Okay, I wanted to ask if you could just give us an update on the county's timeline for moving to phase 1C, and whether you're confident that the county is going to be able to meet President Biden's call for all adults to be eligible by the first.
So, when are we going to move to 1C? We're not nearly there yet, and I don't want to speculate on when we're going to get there. As to the president's assertion that we should be able to schedule appointments by May 1st, we hope and pray that there's sufficient vaccine to do that. All right, who else? Israel, do you want to speak to that one?
So we have been working with our public health department to make sure that we look at different factors. So one of the things that we're proud to report is for at least the area of suburban Cook, we're at about 60% have at least gotten their first dose. But we also look at the demand for appointments that have been able to look at how quickly our appointments fill to see whether we've hit that gap. And we, again, following CDC guidance on the risk points, we want to make sure that as we move, one of the decisions to move is that you're starting to see a slowdown in the amount of individuals who want to get the vaccine. We actually just continue to release. We inform the media every time we release appointments, and you can also see that they're being filled, the majority of them within an hour, hour and a half, 2 hours. So we're not at the level where you're seeing a drop-off on the demand. However, as we start to see more individuals vaccinated, we'll work with our public health officials to make the determination, but the real driving factors are the amount of people left, the amount of vaccine that we have, and then the amount of people still left in that protected group that need to be vaccinated. And that is really the CDC guidance to make sure that we're trying to get those most at risk immunized first. It's still steady. So it's been better, actually, to be quite honest. We saw that our hospital workers we started to see sort of a slowdown at around 50%. So to be at 60% getting the first dose and still seeing that very strong demand, that's great news. And it means that more people are starting to be willing to come forward and be vaccinated, and that's great news for all of us.
You mentioned that the survey data that informed the campaign from January to February, obviously over that same stretch, we were seeing many officials here across the country, right, around the world, again, advocating the safety, efficacy, we need to get vaccinated. Why do you still feel so important to be launching something like this today? And, what would you say to people who are watching this at home, who live in Cook County, they're like, yeah, I know all this already, I just want my shot. What do you say to those people who might see this as misdirected use of resources right now as opposed to whatever else they might think you should be doing?
So what we always see, there's a few factors. We see people kind of break down into two camps. One camp is, I wanted my vaccine last month, and how dare I not have it right now? And everyone's working for it. And unfortunately, we still don't have enough vaccine to even get to that camp. However, part of why you see some of the inequities that our data show, and still a lag, is that there is still a group of people who have yet to see that information. And we see a lot of misinformation in the campaign out there also going forward. Our commitment is to make sure that people see who's being vaccinated, to have the stories of others shared, to share that information as much as possible, and to help everybody get comfortable. The hesitancy is real. It is still there. The misinformation that is put out there is still there. And so our commitment has always been to make sure that we tell the truth, that we provide everyone the facts, and that we share the stories of others so that everyone becomes empowered to make the decision for them and for their family. It's going to be a constant push and pull till hopefully one day we'll be here saying everybody has been vaccinated. That would be a great day for all us all.
President Preckwinkle, obviously this has to do with convincing people to get the vaccine to begin with. Those who have been convinced, there was a report last week of concern over security of signing up on the Cook County vaccine website where someone signed up their elderly mother, 90 years old. I'll tell you kind of before one of this. Signed up their elderly mother, got a call the next day to schedule their appointment at Walgreens. They showed up for their appointment at Walgreens, and she said that there was no appointment that was made. Her concern is that this information, somehow that she supplied through the Cook County website, has gotten out, and that there is some sort of concern for data security.
All right, let me ask Israel to respond.
Sure. So that information was shared with us, and I can tell you that we monitor our data very closely. And so our website is monitored by the same types of technology that safeguards every website, every governmental entity, Amazon, others, and we have reports. There is nothing that has been shared between us that at all has any kind of compromise to our data, our website, our integrity. That being said, why these campaigns are important is because unfortunately there are sometimes misinformation that is put out there, and there are those who would take advantage of individuals wanting to get the vaccine. That website, I don't know if it was timing or not. I know we've asked to speak with the individual who made that assertion to the media so we could be able to connect with them to see what happened. But we have been informed nationally that is something that's going on about them having questions on Walgreens and people calling to get information. And so we just always encourage everyone that, they're asking for financial information or information they shouldn't have, to take caution just the way we would. And so identity theft is something that's out there. It's very unfortunate that people are wanting to do that during this time. But as far as the data integrity, we have not seen anything at all that questions the integrity of the website, the data, or the information that's out there.
That would be for an external threat. Is there any type of look inside that
Yes.
makes sure that someone inside Cook County may not be supplying it?
Yes, all of our callers are supervised or monitored, the data integrity is reviewed, everything they do with those portions, and it prohibits being able to take that data.
President Preckwinkle, just a follow-up on the reporter's timeline question. I know you said you're hoping that the supply will be there. If the supply suddenly booms and there's a lot more vaccine available here in the county, do you think the county is ready logistically otherwise to launch on March 29th? You know, I mean, if it came up with 1C, May 1st, do you think everything else is in place or is it just about vaccines themselves right now?
Well, let me just say, we've been helped tremendously by the presence of the Illinois National Guard, who staff our mass vaccination sites and who have helped us at our clinics as well, both at Tinley Park and Des Plaines, which are the sites that do a couple thousand vaccines a day. We have the capacity to do considerably more. So I think if we have the vaccine, we can get the shots in people's arms. It's just a question of supply, and predictable supply, as Israel and Dr. Joshi said earlier.
And the modeling with where supply doesn't need to be indicated for 1C bucket.
Pardon me?
The modeling, I don't know if you have any modeling for where you think supply will be in the coming weeks as we get more, but
As I said, the challenge is that the supply is insufficient and unpredictable, so.
all right, I think we're good.
All right?
Questions? Thank you.
All right, thank you all.